A dental implant is a titanium screw that fits into your jaw, and then we will then screw a tooth on top of that, which replaces what would be there normally. So the dental implant is the root, and then the crown on top would replace the crown of the tooth. A bridge is different because we have to prepare other teeth to replace the missing tooth. So this way we don't have to destroy any other tooth structure. It's hard to say whether or not you would be a candidate for a dental implant. The best way would be to come in for a consultation. We can then talk through your options. We can have a look at your bone quality, the space in your mouth, whether or not it's appropriate to put a dental implant, and we'll take 3D scans and pictures to really explain and show that. So it varies. It depends on the sort of situation when you come in to see us, but it can be as little as 3 months from surgery to having the crown placed. That's actually one of the biggest misconceptions about implants. They're often more comfortable than having a tooth out. So people generally find them to be fairly straightforward, and the recovery is very comfortable. Dental implants have a very high success rate. They can last up to 30 years, but the success rate is around 97% for about 10 years, but most last much longer. So the risk with dental implant is that because the implant is directly in the bone, they require a bit more maintenance than a normal tooth does. So the issue can arise if you're not keeping them clean, you're not having them properly maintained. They can develop a style of gum disease around the implant, which can cause bone loss and then early loss of the implant. So there's not really many diet rules, but it's important to keep the implant as clean as possible, to come for your regular hygiene visit, and to come back and see us once a year to have the implant reviewed to make sure that the integration is still solid and that there's no bone loss. Yeah, an implant is the closest thing we can get to providing a natural tooth. Most of our patients don't really notice the difference between having a dental implant and having a tooth. Maintenance is very important when it comes to dental implants. It's very important to come back and see the hygienist regularly to have your implant checked and maintained. We recommend coming back at least every 6 months, but also the main thing is what you do at home and making sure that you're being thorough with your flossing and your cleaning around it. So if you don't have enough bone, it doesn't mean you won't be able to have a dental implant, but it does mean that we might need to do some extra bits to try and bump up the volume of bone so we can put an implant in. That can be grafting with little granules of bone, which your body then takes in as its own and makes new bone, and that can allow us to then place the dental implant. That does increase the cost a little bit, but not significantly.